So this lighting system that apparently makes dawn and dusk to really help these patients. And honestly, it sounds absolutely perfect. So I wanted to.
Well, you gotta get into that psychiatric ward then.
That's not really where I was going with this.
Well, that's where they have it. I see no problem.
Wow, okay. Welcome to the 44th episode of the Struggling Scientist podcast. We are a podcast by scientists, for scientists, anyone science adjacent, and perhaps even hobbyists. My name is Susanne, and I'm here with my co-host, Jeroen.
Hi. Yesterday,
we had the first real frost here in the Netherlands. And now that we have the first evidence that winter is finally here, we knew we needed to do a special winter-themed episode. So today, we're going to talk about the winter dip, or more officially called Seasonal Affective Disorder, also called SAD. I've wanted to know more about this for a long time, so let's start. So winter is coming, at least here in the Netherlands, now that the first real frost has hit us. And it has hit us quite hard right away. I almost couldn't open my car. And a colleague's bike was so frozen that her brakes got stuck to her wheel. Which is a very, very Dutch thing, I would say.
I mean, other people also have bikes around the world.
Yeah, but do they get frozen while you're trying to bike to the metro? I don't know.
Yeah, I guess.
Now, quite funny, of course, but the changing of the season can have a real effect on people's mood. And we wanted to know more about this winter dip. So, of course, we did a deep dive into the literature. We're here, ready with a warm cup of tea on this cold, cold day to talk some science with you guys. And we have gathered an enormous amount of information from many papers and are going to try to shape this into something that is both enjoyable to listen to and interesting. So yeah, let's start with the basics. Jeroen, the winter dip, what actually is it?
Well, Suzanne, it's also called Seasonal Affective Disorder, or SAD, as you alluded to previously. And it's a type of depression that's related to changes in the season. And in most cases, SAD symptoms, I guess, appear during sort of like the late fall, early winter, and tend to go away when it's, well, sunnier spring, summertime. There's also another variant of it that's sort of less common, where people have the opposite pattern and it shows symptoms of sort of depression that begin sort of in the spring and summer. And then
that sounds more like you, to be honest.
Maybe. Or maybe I'm just, yeah, I don't know. In either case, the symptoms may start out mild and become more severe as the season sort of progresses.
Okay.
And it's a pretty, well, relatively quite common condition. The numbers sort of vary depending on which papers you read and which geographical area the research was carried out in. But in general, so we have like the numbers for the US, and there about 5% of the US population suffers from it, suffers from SAD. And they report symptoms that are present over basically 40% of the entire year, which is quite a lot, actually. Yeah, that's intense. And what we know about SAD, at least from digging into the research a little bit, is that it tends to be predominant in women. Sorry again, ladies. And it's also particularly common during, and I quote, childbearing years.
Okay.
So on top of, having weird food cravings, you also might get sad, but not that kind of sad, this sad. And there's a quite, depending again on the paper you read, the reported sort of female to male ratio seems to be something like 4:1. Okay. So it's quite skewed as well. And it's been shown, or the rates for SAD at least have been shown to sort of decline with older people. So older people are less likely to suffer from it. With older men and women sort of having equal susceptibility. So that sort of difference between men and women also disappears over time. And also some children are susceptible to developing SAD as well. So it's not necessarily just an adult thing.
No, but it does seem to be like after teenager years, like 16 onwards, it increases a bit.
Yeah.
And I think it was also really interesting to read that many people also have it in a milder form, where you just, in the winter you're a bit slower, you sleep a bit more. But
you're a vegetable.
Yeah, they call it vegetative symptoms. You're not a vegetable,
You're a vegetable.
But they think that it's more based on energy conserving, which are the core symptoms of SAD. And that might actually be the evolutionary reason to have it, because, of course, evolutionary speaking, we were always less busy in the winter and less, we were way more busy in the summer, and then in the winter you would relax a bit. And I think we actually get back to it later too. But you were hearing you say that it is very pronounced in females. There's actually also a theory that, evolutionary speaking, apparently it also has a real effect on your wanting to reproduce. And that meant that women would get less often pregnant in winter, which would mean that they would mostly get pregnant in summer. And then the child would actually be born in a more advantageous season for it to be able to survive, and not during the winter, which is not good for babies. At least not in the past, right? So they think it was really an evolutionary system to help with survival that we are now sort of stuck with, now that we have overcome all these problems. So yeah.
Yeah.
You have no response to that?
Look, I am not going to talk about female reproduction.
Not just female, also males, but just like that combination leads to less pregnancy in the winter, starting in the winter.
Yeah.
And that's better.
But body heat.
Yeah. Okay. Now that we know a little bit about what it is, and we have even already talked about some evolution, Jerome, why don't you tell us what actually the symptoms are of SAD?
Yes. So not to be confused with that other SAD. So the symptoms for SAD differ a little bit, but they come together in the form of feeling listless to a certain extent, sad or down most of the day or nearly every day, losing interest in activities you once enjoyed, having low energy and feeling sluggish some of the time, or a lot of the time, having problems with sleeping, too much in this case. In addition to that, you can also experience a sort of carbohydrate craving, overeating, and which eventually leads to weight gain as well. You can also have difficulty in concentrating. You could feel hopeless, worthless, or guilty. We keep it upbeat here in this podcast. And lastly, you could also have thoughts of sort of suicidal thoughts, or not wanting to live anymore, and stuff like that.
Yeah, and of course, if you have any of these symptoms, please find a professional to talk with. And yeah.
Yes, this podcast is definitely not psychiatric help.
No.
But so those were sort of the more general types of symptoms, and we can also make a distinction between sort of the more winter depression, winter SAD, and the spring and summer version of SAD, and then they differ a little bit. So for the more specific to the fall and winter type of SAD, you have the oversleeping as a major symptom. In addition to that, you have the appetite changes, especially towards a craving for carbohydrates, which eventually leads to weight gain, and also tiredness and low energy. Whereas in the sort of more spring and summer SAD, you have somewhat of the opposite. So you actually have trouble sleeping. So you have somewhat of an insomnia, sorry. You may also experience poor appetite, also weight loss, which basically the opposite of what we see with the fall and winter SAD. In addition to that as well, you have sometimes agitation or anxiety and increased irritability.
Yes. Okay.
So I'm still surprised that it's sort of called the same thing, SAD, but depending on the season, it can be so different.
Well, the whole thing about SAD is that it's like your mood affected by the seasons, right? It doesn't necessarily say that it has to be winter.
No, I know, but I'm just sort of thinking in terms of naming the disease, I guess. But yeah, that's besides the point.
I would say that the winter dip or the winter depression or the winter, it's a lot more known than.
No, for sure.
That you can also have it about spring and summer.
Yeah, I didn't know that was an actual thing. I thought that was just something I was joking about. But apparently people actually suffer from this, and who knows?
Yes.
Yeah.
Okay, now there's also several risk factors that make it more likely to have it, of course. Now we already talked about women being more likely to have SAD. What are other ones, Jerome?
So you might, depending on your family history, you might also be more at risk of developing SAD. So people with SAD may be more likely to have blood relatives that also suffer from depression. In addition to that, having major depression or bipolar disorder may also be a risk factor for developing it. And during the season, your depression might actually worsen if you have one of those conditions already. You may, in addition to that, also apparently living far from the equator, so the latitudes, is a risk factor for developing SAD. So more Nordic people appears to be more common for people living in the north or very, very far in the south to suffer from SAD. And this might be due to the decreased amount of sunlight that they get during the winter times. Mm-hmm. In addition, you may also have another risk factor is also the low level of vitamin D. Some vitamin D is produced in the skin when it's exposed to sunlight. Vitamin D can normally help to boost serotonin levels. But if you have less sunlight and you're not getting enough vitamin D from foods and other sources, this may result in low levels of vitamin D in the body, which...
Oh, well, I was already so surprised that I found nothing about vitamin D in like the causes, because I thought it was one of the major causes of this. Mm-hmm. But apparently it's via the serotonin that... okay. Yes. So it does have some effect, vitamin D. Yeah. But not in the way that I thought. Okay, clear.
Yeah, I thought like for vitamin D, you get the tryptophan, which then is the ingredient for... Yeah. Yes, so indeed, the vitamin D via the serotonin pathway, I guess.
Yeah, but vitamin D doesn't directly cause or help against SAD. Only via the serotonin. Yeah, okay.
Yeah, I guess, yeah. In addition to this, what we found out in the literature as well is that apparently people who are visually impaired are also at greater risk of developing SAD. I guess it has to do with... So apparently about 17% of the population that is visually impaired experiences a seasonal variation in their mood, so more likely to swing towards the SAD and be depressed and stuff like that. Whereas it's only 8% for us normal-sighted people, I guess. And yeah, so they're just more likely to develop SAD, and to a certain extent that I guess has to do with not being able to really perceive the sunlight as much. Yeah, that puts them at greater risk. And lastly, another risk factor for developing SAD is age. So apparently it's more prevalent in adults under the age of 40 than over the age of 40. So you're actually less likely to have SAD when you're older. I guess if, as you get older, you don't care anymore, maybe, or something like that.
Well, I think it might also have to do again with that evolutionary reason for SAD, that it might have something to do with your reproduction and that you want to reproduce in the right season. Because over 40, I mean, reproduction is not happening that well anymore.
I guess. I mean, males are still very, very, well, not super sexually active, I guess, either by that time, maybe, but...
But they are not the ones that shouldn't get pregnant.
No. Yes, biology doesn't work that way, indeed.
Yes. Okay.
Shall we move on to diagnosis then?
Yes.
So, as far as we could find, that there was one clear method of way that people use to, diagnose SAD, and that is the Seasonal Patterns Assessment Questionnaire, or SPAQ. And you can sort of find a version of this online as well if you want to have a look at it. But basically what it is this type of questionnaire instrument that you can fill in, and it provides you basically have to provide information on your mood, how much you eat, relative to other periods of the year as well, of course, because you're trying to figure out if you're more depressed in one period of the year than other periods of the year. And then also, at least in the version that we came across, they also mentioned stuff along the lines of how active you are during that month versus the other month as well. So it's really measuring a lot, but it's relative to other months. And it's important to mention that this SPAQ doesn't really do a great job. It's a good screening tool to figure out if you might have SAD, but it's not a good diagnostic. It doesn't have a lot of diagnostic validity in trying to figure out whether you have SAD or subsyndromal SAD, which Suzanne can maybe tell you a little bit more about.
Yeah, that was the version where you have some symptoms, but they don't actually hamper you in your daily life. You're just sort of more in a winter setting where you sleep a bit more and you're a bit more chill, I would say, than in summer. But that is evolutionary meant to be that way almost. So that you don't have to be treated for that, actually. It's only when you really your mood and your behavior and you become really depressed, then of course you need to find some help. We will also go over treatment options later in this episode, but definitely go to a professional if you think you have any sort of depression symptoms, whether they're seasonal or not. Find some professional help.
Yes.
Okay.
So, Suzanne, can you tell us a little bit about the causes of SAD?
Well, this is where the science gets interesting, right? So, there's two main bodies of work in the research field about this. And the first one mainly focuses on the circadian rhythm and the melatonin levels as a cause of SAD. And the second body of work it really focuses more on the brain process and the cytokines and neurotransmitters that have an effect on SAD, and then mainly things like serotonin, norepinephrine, and dopamine. But the general consensus is really that it's caused by a combination of things and that it's never just one. But even though that is the case, we'll still talk about all of them. So the first one is the circadian phase shift, which is basically a shift in your circadian rhythm. So your body has circadian rhythm that is regulated in the surochiasmatic nucleus or nuclei, the SCN center, of your hypothalamus. And when that circadian rhythm is not aligned with when you have to wake up and when you sleep, or when you would like to wake up and when you sleep, that means that it's shifted. So it might be that you still wake up at a certain time, but that your body physiologically is just not in that same space as you. And that's when you have this disconnect between your circadian rhythm and when you're actually waking up and sleeping. And that might be a cause of SAD. Now, your circadian rhythm is really dependent on certain cues, and one of them is light. And research has shown that there are light-sensitive retinal ganglion cells that send signals to that SCN center in your hypothalamus, and those are independent of your usual cones and rods with which you see. And these cells actually express newly discovered photopigments such as melanopsin and cytochromes. And yeah, it was really interesting to find these special cells that communicate with your SCN center. And our researchers have been really trying to find if this phase shift is actually happening, right? But it's really difficult to measure this in people. And the results of these studies have varied a lot. But a really recent study has shown that when you measure melatonin levels in your saliva, that 71% of the SAD people indeed have a shift in the circadian phase, of a delay shift in circadian phase, while 29% of the people actually have an advanced phase. And it was actually expected that SAD people would have way more of the delayed one, where you just sleep more, you're not really waking up in the morning, than the advanced phase, where that's the exact opposite, right? Mm-hmm. And that's way more common than originally thought. And this makes light therapy a really interesting treatment for SAD, because all those people who have a delay in the circadian phase could really do very well if they have some morning light therapy, so that this circadian rhythm can be reset by those special cells in your eye that send signals to your SCN center. But it turns out that 29% of people actually should have some light in the evening instead of in the morning. So that's actually quite interesting, I would say.
No, for sure. And I wonder how much you would have, like how big that phase difference would be, how many hours or something like that.
Yeah, that I'm not sure of.
Yeah.
They were already really happy that they could measure it now by measuring melatonin in the salivary samples. And that actually leads to our second suspected factor, which is actually the melatonin. And this is a hormone that affects your sleep patterns and mood, and really also has to do with your circadian rhythm. It's actually also regulated in that same SCN center in your hypothalamus. And it is secreted by a gland, a pineal gland, in response to ambient darkness. So as long as it's dark outside, you make melatonin, and then when it becomes light, your SCN recognizes that, and your melatonin goes down. Melatonin is actually really important, again, for your circadian rhythm, because in animals, this regulates seasonal changes that have to do with like winter and summer, because animals need different behaviors in summer than they do in winter, including food intake, reproduction, and this is all done by the melatonin signal that is affected by the length of the day. So if the day is shorter, you have more nights, you get more melatonin than when you do during the summer, I guess. And while this anatomical circuitry is also present in humans, the functional significance in our species remains controversial. So, interesting. Now, there have been multiple studies looking at people with SAD and their melatonin levels, but so far it has been really difficult to show actual differences in the amount of melatonin levels in these patients. There was one study that showed that there was a bit more daytime melatonin during depressive episodes in these patients, and this did become better after light treatment. So that was interesting, but it's more likely the sort of the combination of your melatonin and your rhythm that together has an effect on this, right? Now, really interesting is that this is based on the lack of light, right? And if you would expect that, or hypothesis about that, that means that if you go further north, you get more and more people with SAD. And that's indeed the case. There's a correlation of 0.66 between latitude and the rates of SAD. And I think in some of the northern countries, it can go up to 10% of people suffering from SAD. But if you think about that, over time, you would expect that people who really suffer from SAD the worst don't want to live in the north, so they move more to the south. And then you would expect that the population that lives in the north would be somewhat resistant to SAD.
SAD resistant, yes.
SAD resistant, yes, indeed. And it actually turns out that if you take Icelanders and you move them to Manitoba, Canada, their rates of SAD are much lower than an ethnic population that is similar latitude. So it does show that these Icelanders might be potentially genetically protected against SAD. Over the state of Canada, another study from Canada, you don't see that negative correlation between latitude and rates of SAD anymore, which is another sort of indirect show that people might have moved more to the south, that they suffer more from SAD. So, but I think it's really interesting. It's also a clear, idea that it might have also some genetic effects.
Yes. Although at a certain point, I wonder if you just tough it out, you'll eventually get old enough and you'll survive the SAD anyway, or something like that. I don't know. I think it's interesting.
I don't know. It's mostly over time, right? So you expect over time that certain populations become more SAD resistant if they live to the north.
Yeah.
Whether that is that non-SAD people just reproduce more or they move to the south, I will leave that up to the researchers.
More research is required.
So, and then there was this other big part of the research that looks more at brain neurotransmitters in SAD. And I've mainly found things about serotonin and dopamine. So I wanted to start with serotonin, which is a neurotransmitter that affects food and food intake. And there's really quite a lot of evidence that there is a seasonal rhythm to serotonin metabolism and turnover, and that serotonin levels are decreased in the winter. And now researchers have tried to give SAD patients serotonin replacements or probes or whatever they could find, and there were really mixed results. However, one paper showed that SAD patients during a depressive episode actually reported an increased activation of euphoria relative to the controls following administration of this drug. And these responses seem to resolve after light therapy. So they seem to be a stable marker of winter depression. And I'm honestly surprised at all this research, how well light therapy seems to work. But we will get back to that at the therapy part.
Spoilers.
Spoilers. They've also tried to deplete serotonin by giving them certain dietary interventions where they take out one of the most important amino acids to build that precursor of serotonin. So then you get less serotonin in your brain. And the SAD patients seem to be really more sensitive to that than controls. There have been relatively few brain imaging studies looking at serotonin functions. However, one study showed a reduced availability of brain serotonin transporters, which are responsible for the reuptake of serotonin in SAD patients. And these findings were the clearest in the thalamus and hypothalamus, which is interesting. Yeah.
No, for sure.
However, no gene, like no mutations or whatever, have been found that link serotonin to SAD. So because people have, of course, been trying to find a genetic component that might be causing this, but in SAD, nope. And then the other neurotransmitter that I found a lot about was dopamine. And it has many unique characteristics that might play a role in particular aspects of SAD syndromes, particularly the overeating. And it has a really big role in the brain reward processes. So that's where dopamine plays the biggest role. And it actually is really important also for your light-dark adaptation in your retina, where it has a mutually inhibitory relationship with melatonin. So apparently dopamine is also there really important. And there is a D4 receptor that's important in the pathway of the dopamine. And some studies, electroretinography studies, have shown that SAD patients have a reduced B wave amplitude for this receptor. So they respond less when it's activated. And this might reflect low retinal
dopaminergic
activity. And there's actually a mutation in this DRD4 receptor that has been linked to SAD, but also to childhood dysphoria, inattention, and various manifestations of overeating and obesity. Interestingly, though, this 7R, like the allele, this repeat, has been positively selected for in recent human evolution, which is interesting if you think about like the evolution of SAD and why we would want more SAD.
More overeating and
but again, that might go back to the fact that you don't want females to get pregnant during the winter, and that was actually still quite relevant not too long ago. So that might actually be also a reason why this is happening, and especially also people who live more north actually want to become pregnant even less during the winter and then have babies again just before winter, and then the baby has to survive the winter, right? So in that sense, it's actually a really important evolutionary system, which might make you feel a little bit better, maybe.
Does it though? It doesn't change it.
It's normal. It's supposed to be that way. It's natural.
Now I know to not plan babies in the winter.
Don't plan babies in the winter. Very true. Yes.
Life advice.
Okay, well, those are the four main causes of SAD that I could find. And as stated in the beginning, it's most likely a combination of these four.
Yes. So I guess that brings us then to how you can try to prevent the development of SAD. So first things first, there's no real 100% way to prevent developing SAD. You can only really take steps early on to try and manage the symptoms if you know you have it or are susceptible to it in the winter. Some of the things you can try out are, for example, starting out your treatment a little bit earlier. That can help stifle some of the worst reactions to your mood, your appetite, your energy levels. And yeah, since you know it's coming up in the winter, and just sort of like keep those complications in check. Some people just find it very helpful to be able to start earlier on, already in the fall, before their symptoms really get bad. While other people need continuous treatment to prevent the symptoms from returning or as badly as it normally does. You can already start light treatment early in the morning before you sort of develop the symptoms, and if you know you are at risk, So yeah, it really is just trying to manage those symptoms as much as possible. You won't 100% get rid of them or like prevent them from coming up, but you can really try to lower them and make them less influential on your daily life during the winter as possible.
Yeah, one thing I really hate is the daylight savings clock change that we have. That really causes some problems for me. Also in this era, right? It's like a major shift in your rhythm that all of a sudden has to happen, and your body isn't used to it yet. that like is one of those time periods where I really suffer. I don't necessarily have SAD, but I know that my body is not happy with this.
Yeah.
Okay, and then when we get to treatments, we have 3 different options. We have the light therapy, pharmacotherapy, which basically just means drugs, and cognitive behavior therapy. Interestingly enough, none of these treatments or combination of treatment have been found superior. So the treatment choice is usually up to the patient and what works for them and what they like and what works for them in their life. There's quite a few published studies on the effect of light therapy in person with SAD. Not all of them meet the standards of like really good studies with an acceptable placebo, which is of course difficult because people will know if they're looking at a light or not. But they have been really trying hard to get something good. Now, practice guidelines for this type of treatment is that patients should be positioned 12 to 18 inches from a white fluorescent light at a standard dose of 10,000 lux for 30 minutes per day in the early morning. Now, big comment with that, of course, is that if you're in a group that has a phase delay, that works really well. But if you have, if you're advanced in your circadian rhythm, you would actually need it in the evening. But there's no way to test it. So I would still recommend trying it in the early morning and then seeing if that works for you or not. But maybe if it doesn't work, try it in the evening. Who knows? Now, while you're doing this, you need to be awake with your eyes open, but you're not required to look at the light directly, so you can eat or read or whatever.
Multitask.
As long as the light enters the pupil, because you want those special non-rod, not cone cells back there to find the light and then send it to your SCN center, as we have just learned. Ultraviolet wavelengths have not shown to improve anything and should be avoided because of potentially harmful effects. Okay, it has been shown to be significantly improved after 2 weeks of light therapy. However, when treatment is discontinued, patients relapse after a similar period. So you should be doing the light treatment continuously until spring or summer when you don't usually have this anymore. But it does seem to work in about 80% of people, which is quite a bit.
No, for sure. It's very effective then. Okay. Yeah. So in addition to that, we mentioned that blind people also, or visually impaired people also suffer from SAD. And there's actually at least been one study that looked at treating visually impaired people with light therapy. In this case, they provided a daily, sort of a light box daily for 6 weeks to these visually impaired people. They had to sit about 35 centimeters away from it. And again, with that sort of 10,000 lux, which from what I've been able to tell is about basically ambient light level. So not that intense of a light source that you can sort of look at it even if you are visually impaired. And what they saw is that the visually impaired people, even though they were visually impaired, the having access to the light source basically lowered all their symptoms and the measurements of SAD, sort of depressive measurements that the researchers were looking at. Yeah, so yeah, it works on the visually impaired people that they sort of reduce all the SAD metrics that the scientists were measuring, at least with the questionnaires and stuff like that again. So it definitely worked for that. And to a certain extent, in again, I have to say that this study was sort of problematic because they originally wanted to recruit 184 visually impaired people, but because of a lot of reasons like dropouts and people who also had visual impairment that they couldn't look into sort of a direct light source like this light source that they were providing without having more visual impairment. There was some diseases like that. And just failure to follow up, they ended up with 12 people. Oh. So that makes it a little bit more complicated to look at all these results. But for what they could measure with these people, it definitely helped. And it also improved sleep quality over daytime and reduced napping as well and nightly awakenings. But not significantly, I do have to mention.
Okay.
Yeah.
Okay. Now the other treatment that we have is pharmacotherapy, which is basically drugs. Now, I'm not going to mention any of these drugs because this is something that you should discuss with your professional. However, we can, of course, talk about some of the results of studies. There was this one study who tried either light therapy for 30 minutes a day or a placebo, which is only 100 lux light therapy for 30 minutes daily. So they did get a light, but it was just a lot less bright, which is then maybe a better placebo than not having any light, right? Or a drug or both. And they found that the clinical response was similar, and that the group actually receiving the light therapy at the higher dose actually had an earlier response, to so-called faster, better, and had, of course, a lower rate of adverse effects than the drug group, because a drug always, usually has some some side effects, of course. The combination was comparably effective and well tolerated. Anyway, the conclusion mainly was that light therapy and drugs seem to work just as well.
Equally as well, yeah.
Equally as well. And then light therapy can give you some side effects, like seeing a bit blurry, or like being a bit dizzy for some people. But yeah, I mean, if it doesn't work, of course you need the drugs, and you have a real depression, and of course you need the drugs. But you should decide that with your professional therapist or doctor or whatever you have.
Yeah. I should also mention that there was one study we came across that looked at light therapy for non-sad people, so just normally, I guess, depressed people, and there as well it showed some benefits. So that's also nice to look into. Yes.
Normally depressed people. Okay.
Those normal folk.
Sure.
Those around the equator, I guess.
Okay. And then you also have cognitive behavior therapy. That also seems to be beneficial for SAD. It's basically just with the help of a professional guidance, change your thinking patterns a bit. So 2 studies showed that cognitive behavior therapy, light therapy, or the combination showed all sort of the same good result, all significant improvement. Combined treatment had the highest remission rate, but it was not statistically superior to just the one alone. So it seems to all work equally well. However, the cognitive behavior therapy does seem to also have some positive effect for the following year, and the light treatment does not. Then you need to restart the light treatment, of course.
You need more light.
Yes. So that was basically the treatment options. Again, I am so surprised that light therapy seems to work so well.
Yeah.
This really, like, just as equally well as like going to real therapy like twice a week. I think they did the CBT, the cognitive behavior therapy, twice a week, 90 minutes.
Yeah.
or treatment with a drug that has like some real side effects, right? The light therapy seems to be amazing.
I mean, I also would imagine that it's sort of easier to, what's the word again, like stick to a light treatment for like 30 minutes at ambient light level.
I mean, if you do it with your breakfast every day, it's quite easy.
Yeah, exactly. Like versus actually going to someone and getting training for like the CBD and stuff like that. Like, yeah.
Okay, now while researching this, I also came across 2 really interesting papers that I just want to casually mention here at the end. One was about looking into rodent models for SAD, but the problem is that, of course, your circadian rhythm plays a really big role in this. And in mice are awake during the night and sleep during the day. So they are really horrible for circadian rhythm studies. So they were looking for rodents that are awake during the day and asleep at night. So they're actually considering the fat sand rat, the fat sand rat, and the nowgrass rat as potential models for SAD, which they didn't get any further with, but I still think it's funny.
Soon in the future, we will have SAD rats.
Yes. And this other study that I just want to mention very quickly is that they had a bedroom lighting system which automatically made artificial dawn and artificial dusk installed in a psychiatric ward. And it actually really showed to help these patients. They generally woke up a bit earlier, they slept longer, and they had a higher sleep efficiency and really didn't wake up as much as normal. So this lighting system that apparently makes dawn and dusk really help these patients. And honestly, it sounds absolutely perfect. So I wanted to.
Well, you gotta get into that psychiatric ward then.
That's not really where I was going with this.
Well, that's where they have it. I see no problem.
Wow. Okay. Okay. Well, I guess that was all the science that we wanted to tell you guys about today. We hope it was sort of organized and fun to listen to.
Yes.
If you really want to support our podcast, you can, of course, follow us or give us a rating on your preferred podcast listening platform. That would really, really help us. You can also follow us on our social media. Jaden, which one are those again?
Twitter, Instagram, Facebook, LinkedIn, and also Mastodon.
Yes. Also sign up for our newsletter, which is a lot of fun via our website, thestrugglingscientist.com. And if you have any questions, comments, suggestions, papers you really need to read, you can contact us via thestrugglingscientist@hotmail.com. Thank you so much for listening and hope to see you next time. Bye.
Bye.